Welcome to Coping Together, Mental Health Association of Central Florida's live web series dedicated to helping you develop coping strategies and wellness tools related to COVID-19, as well as talk about mental health. Coping Together was created in response to COVID-19's mandatory social distancing orders. This show seeks to learn and educate. We do not speak for any particular group. Overall, Coping Together serves as a platform through which we can demystify and unpack mental health concepts and hear from experts in the field. Please note that this show may discuss sensitive topics, including but not limited to sexual assault, suicide, and various traumas. If you find yourself feeling upset or struggling during any episode, listen to your body and pause the input. We will post related resources. Remember, it's okay to get help.
Hi, welcome to Coping Together. I'm your host, Faith, with the Mental Health Association of Central Florida. Always excited to talk to you about the topics here related to mental health and COVID-19. Today, I'm very excited to be talking about mental health first aid, and I have the perfect mental health advocate here to explain and talk to us about that. So I'm very excited to welcome Marie Brown. Marie, how are you doing today?
I'm doing great, Faith. Thank you so much for having me.
Absolutely. Thank you for being here. And before we get started, can you just tell the audience just a little bit about yourself?
Sure. I consider myself a mental health advocate. I have been involved in it since the death of my daughter in 2003. My daughter, Natalie, took her life by suicide. And after that, I really came to understand that most of us are definitely afraid to have the conversation. We're worried that we're going to say the wrong thing to someone. And that's the only reason that stops us from reaching out to people. I came across the mental health first aid course early when it started in 2008, and I was trained and I began facilitating the course in 2009. And since that time, I've, really enjoyed doing that. And now with COVID, it's been where, you can't have all the people in the group. So that has stopped that, having those courses. However, a lot of them, we've just found out, because mental health first aid is offered through the National Council for Behavioral Health Care, that they are in the midst of promoting a virtual program. So we will be able shortly to have the virtual program so that we don't have to be concerned about having everyone in one space. So I'm excited about that and glad to be here to tell you a little bit more about it.
Thank you so much, first of all, for sharing that story. I always appreciate people sharing their stories, and I do think it's one of the things that makes us most passionate about mental health is when it touches us personally, directly or indirectly. So thank you for that. And I think you make a really great point that a lot of it, I think the majority of it is people not being comfortable having that kind of conversation or approaching it. And that's something we talk about here a lot on Coping Together. And it's something that I think is important to talk about on, Mental Health Awareness Week that we're in. And so with that, and you actually answered one of my questions in advance, which was, is it strictly a Florida program, the mental health first aid training, or is it nationwide? So I'm very happy to hear that it is nationwide. And we will include the website and any information relevant to that in the description for this episode. So you're able to take a look and look into it.
Great. Actually, the program started in Australia. And when the and they had been doing it since 2001, so there was a lot of evidence behind the program. And when the National Council decided they wanted to bring something like this to the U.S., that's when they found it, and had gone actually around the world looking for other programs similar, and they didn't find anything that had the evidence behind it that it truly does help others learn, the skills that they need so that you can listen and talk with others confidently.
Thank you. I think that that's a really great point, and I'm happy to hear that it started in Australia. I'm actually half Australian.
Oh, cool.
Mom is from there. So I always get excited when I hear stuff like that.
Sure.
Okay, perfect. And you've given me a perfect transition into our next question, which is that, mental health first aid, it has that term first aid associated with it, which we often think of CPR training, first aid training. So how would mental health first aid training resemble CPR training?
Sure, and it does, because in CPR or first aid training, what you're doing is learning the skills that you need to help someone until the professionals arrive. And so the same thing with mental health first aid. You know, you're not necessarily going to have a professional that's there with you when someone is, you know, perhaps having a panic attack or, you know, undergoing a psychotic episode. So that at least, again, it makes you feel comfortable. You know, you're willing to be able to ask, you know, how can I help you, as opposed to perhaps going the opposite direction. And that doesn't mean that you're a crusader. All you are is, when it's appropriate and you feel that, you know, you want to be involved, that you feel comfortable being able to say something to someone without fearing that you're saying the wrong thing, because that's what stops us. It's that fear.
I think that's a really great point, and thank you for that comparison, definitely. And so I also want to ask, this is something that just occurred to me. We've talked before on our show about a program that's brought by the American Foundation for Suicide Prevention, and that's the QPR training. Yeah. Can you explain to me slightly how they differ or how they resemble each other?
Oh, sure. So the programs that are specific to suicide, that is all you're going to be discussing. In mental health first aid, it's kind of like, you know, we all have brains. So we all are going to have mental health things come up in our life, and they're going to be at different levels, you know, kind of up higher one day, down the next, and that. So that the suicide prevention is for that specific crisis. So we talk about that in mental health first aid, again, so that you're comfortable in dealing with someone who's having either suicidal thoughts, or has told you that they want to take their life. But yet we're also talking to you about someone who maybe is just stressed out from work, or the family, or COVID-19. I mean, we're all going through some aspect of stress and anxiety. And that's the portion that's really helpful, is that we don't have to wait till someone's in crisis. You know, we can reach out and just be there for someone when they're experiencing just a difficult time in their life.
Yeah, I definitely agree with you. And I think it's a good point that it's just kind of, we all face things. And it doesn't have to be that you have something to the point of warranting a diagnosis of, you know, clinical mental health disorder, issue, or struggle. We all face, you know, periods of feeling sad, depressed, angry, all these things. And you're absolutely right. You know, it might even be better to be able to be there for someone before it exacerbates. And it's okay if it gets to that point and you need that extra help in talking to a professional. But it also is really great to feel comfortable talking to someone if you have a feeling that they might not be doing okay.
Correct. Exactly. And so important, if you have that feeling, that's when they need you to reach out to them, you know? Yeah. So they feel safe.
Perfect. Thank you for that. And so that's actually a good transition into my next question, which is like, who could benefit from training in mental health first aid? You know, we say that CPR training, you know, I was a nanny for a period of time, and I had had to be CPR trained and first aid trained. So who could benefit from training in this this specific training program?
Sure. So that it could be, you know, people at work, you know, especially in the human resources area, that might be someone that it would be very beneficial for them. You know, policemen, firemen, anyone who's dealing with the public, would find it beneficial. So then we go into teachers, and there are a number of different kind of specialized mental health first aid programs where they specifically talk maybe to, like, so we have adult mental health first aid, so that's specifically for adults, and you're talking mostly about adults. We might talk a little about children in the course, but then there is a youth mental health first aid, and that one is specifically for people who, like teachers, people who interact with children, so that you can recognize what's going on. Sometimes it's hard for us to articulate what's going on in our minds and all of that. But think of a kid. I mean, they have an even tougher time trying to find the words to express it. So, you may have more actions. Maybe there might, show more anger or something. But those are the things that you would want to know about. Those are the signs in that. There's a police and fire and EMS course, because again, people in those positions, deal with some other things, and they need to know some of the skills in this, maybe like church and different people in that category, clergy, it would be important. So again, I guess I go back to, we all have a brain. So it would, it could
we all benefit from taking
it. Yeah. And I mean, it sounds maybe like a cliche thing to say, well, everyone could. But like I said, we all have a brain.
I mean, we all could technically benefit from CPR training. I know I felt a lot better after doing that, and just feeling a little bit more comfortable with the prospect of being faced with the situation where you'll need to utilize those skills. And I think that that's a good point about where we're trying to get to. Those of us who work in the mental health field or who consider ourselves mental health advocates, we want to get to that point where mental health first aid, mental health crisis is seen to a similar level of importance as someone who's, needs you to enact the training you've learned from CPR.
Exactly.
And so, and to go back to what you mentioned about kids, just real quick, I think, especially with COVID, and there's a lot of parents who are now having to virtually or remotely, assist their child. So by that extension, parents could also benefit from this.
Oh, for sure. And, sometimes the mental health issues are even tougher when it's someone that you love, so you feel even more uncomfortable talking to or trying to get them perhaps to talk to you. So learning some skills and listening, learning some resources that are out there. It's really important to have this kind of in your pocket, so that you have an understanding of what's available out there, and to reach out. And maybe you need to, hold someone's hand and do this together, show them resources that are available. Because most people with a mental health condition feel that they're all alone, feel very isolated, and don't realize that there are so many others that have dealt with or are currently dealing with a mental health situation.
Yeah, I definitely agree with you on that. And can you clarify for me, how much does it cost, or is it free? Or...
Sure. Well, you're going to see different costs for the program. The program is, anytime you see it, it's always the same program, but different costs because some organization may have one of their staff people run it, and perhaps that organization received a grant from SAMHSA or elsewhere. And so they can offer it either at no charge or a very low charge. Sometimes you'll see a $20 charge. And the $20 basically covers like the cost of the manual and that. But, they're subsidized in some way. And then you'll have independents And I was an independent, and, I ended up working along with the American Foundation for Suicide Prevention to bring the course to the Central Florida area. So, they were kind enough to sponsor that. And then we had other venues that were willing to provide their space at no cost. So it just depends. If it's going to be free, it's because there is a sponsorship involved. And if you're paying, chances are that, there's no other sponsorship. So the person facilitating, they need to be paid for their time and effort.
And so it sounds like it really depends on the organization or the agency through which it's being held or being sponsored.
Correct.
Okay, perfect. And with, I guess, kind of moving to the virtual platform associated with COVID and everything, how do you anticipate that the promotion and understanding of mental health will be impacted as a result of COVID-19, whether it's impacting the program itself or just in general, that understanding and that concern for mental health?
Right. Well, I think it's brought to people's mind that the stress and anxiety truly can accumulate. And if we don't actually take proactive measures, that we can go down, in the kind of swirling abyss. And so, we don't want people that low. We would like them to reach out for help earlier than that, so that they can get through things a little easier, learn some skills. Mental health is going to affect us through our whole entire life, so the skills that you may learn right now can impact you, your family members, your friends, just your neighborhood and community at large. And yet it also travels with you, because all of that learning, how many of us have actually thought, how am I going to take exquisite care of my mental health today? And I don't know how many people would actually say that they've thought of that.
It tends to go below the bar, I think, of, today I have to do this, like I have to do homework, I have to do work, I have to take care of my kids.
Right.
So it's probably, I'd imagine, pretty down there for a lot of people.
Yeah, it gets pushed off. And so by learning some skills, even a short period of time, whether it's 3 minutes sitting at your desk when you don't know which next thing to do, and, doing some breathing exercises, or if you have time to, meditate at maybe 20 minutes or so. I mean, it can be a lot of different things. A lot of times people, when you ask them what do they do, it takes them a while to think about it, but then they're like, well, I go for a walk. I listen to music. I mean, there are tons of things that people do that they just really don't understand have an impact on their mental well-being. So, by bringing a little bit of awareness to that, people can actually take some extra steps, to help themselves. Because all of the stress and anxiety accumulates. And if we're not really dealing with it, it's going to come back and, bite you some other time.
So it's not just that doing this this training or, just working in general on having a better understanding of mental health, especially in COVID-19, it's not just that it can help the people around you. It sounds like it can also benefit you internally, whether or not you realize it can benefit you internally.
Yeah, and that was one of the benefits that they found actually in Australia when they first started this, and they had never even thought about it. But when they realized, and when they were doing their, measurements of things, when they realized that people actually take away skills and use them for themselves, their own well-being, I mean, that's tremendous. It's something for your lifetime.
Right. Well, thank you so much for that information and for being here with us, Marie. again, just thank you for everything that you have done in terms of mental health first aid training. Thank you for this information. To all of you watching, thank you so much for watching. You're the reason that we get to do this show. If you have any ideas for topics you want to see, please reach out to us at the Mental Health Association. As Marie mentioned, we try to be a resource that are available for people who are going through something. So reach out to us if you've got anything going on. Our Connections program would love to help you. Coping Together, we love to be able to talk to you about these topics and help all of us have a better understanding of it. So thank you again, Marie. Thank you to all of you, and I will see you next time. Thank you.